Hey, welcome to our lesson on Parkinson's disease. Parkinson's disease falls under the concept of mobility. So mobility basically just covers how the musculoskeletal system works along with the nervous system and the circulatory system to allow for muscle movement. So Parkinson's disease definitely falls under that category because it's a problem with the coordinated muscle movements. Specifically, the problem with Parkinson's disease is this loss of dopamine in the brain. So dopamine is responsible for a lot of different things. It's our reward. It gives us pleasure when we do something rewarding, but it also helps with muscle movement. It kind of works alongside acetylcholine, which acetylcholine is what triggers our muscles to move. Dopamine helps to make those movements smooth and helps us to have control over those movements. So when we don't have dopamine, we lose that control over those movements. They become less coordinated and less predictable. So that's the main problem with Parkinson's disease. There are some risk factors. Pollutants, especially pesticides, so areas of rural areas where there's a lot of pesticide use, they have higher incidences of Parkinson's disease. The Amish community, for example, has a lot of incidents of Parkinson's disease. Brain injuries, so anybody who's had repeated damage to the brain, like football players, for example, that have had a lot of concussions, they're going to be an increased risk. Brain tumors, some antipsychotic medications can increase the risk. There's a very strong genetic link, so if it runs in the family, there's a bigger risk for it, and then males are affected more commonly than females. So lots of unpleasant symptoms here. The number one symptom that you'll see is the tremor. So the tremors in the hands, in the face. There's also muscle rigidity and this mask-like expression where there's a lack of emotion in the face, apparent lack of emotion. We also have slowed movements or complete lack of movement at all. Difficulty swallowing, which really leads to a lot of problems with aspiration. Incontinence of bowel or bladder, or maybe even constipation. They also have this slow shuffling gait. I always think of like a zombie in a movie, just moving very slowly. There's not a lot of diagnostic tests for Parkinson's disease. Typically, this is diagnosed based on symptoms because the symptoms are so classic. Once we see those tremors, we kind of already know that this is probably Parkinson's disease. Some of the medications, and we'll go over medications more in class together, but just a few of the medications that we may give anticholinergics that might aid in that muscle movement. Just keep in mind all of the side effects of anticholinergics. They really dry the person up, so we have to make sure they're getting enough to drink. Dopamine receptor agonist, pramipexole, or that's probably the most common one. That's the first-line medication. It does have a lot of side effects like orthostatic hypotension. It can have a lot of psych effects. Poor impulse control, for example. You may see more, high-risk activities like sexual behaviors or gambling or impulsive shopping because of more available dopamine. We're looking for that pleasure. So that it can be difficult for families to understand that, so this requires a lot of education. And then our last line drug is that levodopa-carbidopa. This acts as dopamine in the brain, but it has a wearing off effect. So we kind of save this for a rainy day when we know that we're towards the end of this disease process, because we don't want those symptoms to wear off when they're still actively in this disease process. So we're saving that one for later. But we'll go over medications more together in class when we meet. So lots of nursing interventions for Parkinson's disease. This can be pretty debilitating. They're going to be at a big risk for fall because of that bradykinesia or akinesia. So we need to make sure we're looking at fall precautions. They need to have non-skid footwear. They may need adaptive equipment like a walker or a cane. And it might be difficult for them to operate heavy machinery, so they shouldn't maybe not driving later on in the disease process. We need to try to prevent constipation, so making sure, maybe they need stool softeners, they might not be drinking enough, so we have to monitor that. Think about all the psychosocial effects that this will have. This is a terminal diagnosis, meaning there's no cure for it, and it's progressive. So this can really lead to those feelings of powerlessness. Depression is pretty common. So we need to think about that. Also, that lack of dopamine, it's difficult to feel pleasure sometimes. Because it's so difficult to just eat, the tremors make it difficult to hold utensils, or, there's a lot of dietary restrictions also involved with these medications. They can't have a lot of protein, they can't have a lot of tyramine with some of these medications. So that makes it difficult to get enough calories in. They're also burning a lot of calories because they're constantly moving. So we really need to work closely with dietary to make sure that they're getting enough nutrition. Also think about later on in the disease process, if they're having trouble swallowing, then we may need to think about thickened liquids or pudding consistency diets. So that's definitely something we're going to need to work with dietary on. Also, physical therapy, occupational therapy, there's just a lot of modalities that we work with when we're dealing with somebody with Parkinson's. So some of the complications, falls are quite common, just because of that lack of control with movement. So we need to be careful with that. That can lead to fractures, and a lot of, injuries. Aspiration, so aspiration pneumonia can be pretty common too. So like I said, thickened liquids, changing the diet to soft diet or pudding consistency. We need to think about malnutrition, make sure they're getting enough calories in with all the restrictions that they have, and then monitor for signs of depression. This can be a lot, not just for the person with Parkinson's disease, but also the caregiver of the family. So lots that we need to do for this person. So as always, please make sure that you're reading the material and coming to class prepared to answer questions and be involved in activities. And we'll definitely go over this more in class, especially the medications. So I will see you there.